Hi, I am Andy. I am Benjamin's mama, and today I'm going to show you how to take care of his granulation tissue. This is JJ. If you haven't met JJ, here he is, Ben's favorite cartoon character from Cocomelon. JJ has a G-tube, just like his favorite friend. So granulation tissue is soft tissue that grows inside and underneath his stoma. It's trying to repair the hole in his stomach, right? His body's like, I'm not supposed to have a hole here. Let's try and fix it. And sometimes that tissue comes out of the hole and we don't want it there. So this is a process that we use to get rid of it. And so we use silver nitrate to really like cauterize and burn off that tissue, and it works really well. So I don't have any of the swabs right now, so I'm just gonna pretend like we do and use this Q-tip. What they're essentially, it's just like a Q-tip, it's just longer, right? And nothing on this end. It's like a Q-tip, and it's got the silver nitrate on the tip of it already soaked and ready to go. So individual use silver nitrate swabs. And those will be in here with the skin prep. So what you're gonna do is grab one of these skin preps and grab one of these swabs and like a wipe from his wipes in the diaper caddy, so you can clean up whatever you need to clean up and set the stuff ready for you here. The first thing you want to do is prep the skin all underneath his button and around the granulation tissue. You don't want to get the granulation tissue because this is protecting his skin from the silver nitrate. It'll help it not to burn, and it's super important. So when you'll take this out of here, it's just like a little wipe, and you just want to wipe really, really well. Like, don't be shy. Be liberal when you use this, because we'd rather not have like the top layer of his skin burned. But also have grace on yourself if it does happen. It has happened when the nurses have done it in the hospital. So it happens. Just do the best you can to prepare his skin, so that if it doesn't, the less the better. And you're gonna take this and you're gonna pull, just gently like pull the button aside so that you can see the granulation tissue. You'll clearly be able to see the granulation tissue and how it's different from his normal skin, and also even how it's different from the scar tissue. If you get it on the scar tissue isn't gonna burn. It's not gonna hurt him at all either. So and sometimes we can actually reduce the scar tissue a little bit with the silver nitrate. So what you're gonna do is you're gonna take the tip of the silver nitrate and you're just gonna like tap it and hold it there for a second until you see the tissue turn gray. Then once the tissue turns gray, you can pick it up and move it to another section of it. If it's just a tiny little section, it's probably all you need to do is on the top surface. Sometimes it's really thick and you can like move it over so you can get like the underside of the tissue. As much of the surface area that you can see, if you get silver nitrate on it, the better, right? Because the more surface area that we're going to help to break down the tissue and to get rid of it. So then you just do that. And that's what I didn't get out of here. And then once that's all done, obviously put all of your garbage over there, and then grab one of these split gauze that's in this pocket here, and you're gonna put this on just to protect his skin from that silver nitrate getting everywhere. So you'll use 2 of them. Put one on in one direction, nice and tight there, and then put this on in the other direction. This just helps him to prevent from falling off. If you just use one, it's gonna fall off really easy, but 2 actually keeps it on pretty good. So that is it. You just put back on his clothes, whatever he's wearing, and he's good to go. And that soft tissue will break down in the next couple of days or so, the granulation tissue. And then if it hasn't all broken down in a couple of days, you can do it again to break down whatever's left there. So thank you so much for watching. I hope it was helpful to you. If you have any questions, let us know. Thanks for helping take care of our babe. Be well. Right? Be well.